Today we're going to take on a very important and often overlooked problem in global health, which is the correction of visual problems in children, particularly school children. This is the beginning of the HopeCore Kathy Sangster Eye Health Program, secondary to the great support over many years of Kathy Sangster. She has put together a significant amount of money to allow us to screen and treat 50,000 children. That is 30,000 children in the 132 primary schools that we service, and also 20,000 preschool children that also are in our program. So the importance of this is that in Kenya, in studies in rural Kenya, about 5% of the children need eyeglasses, refractive error correction. Some of them also have eye pathology. What we are embarking on is the beginning to screen all these 50,000 children and to provide better eye health in the form of eyeglasses, and for those children who need it, referral to our own physician and or an ophthalmologist for further treatment of an eye pathology program. The importance of this is simply that one of the most misunderstood problems in global health in the developing world is visual correction of children with eye impairment. So this is one of the most serious illnesses, and it is one of the most easily treatable and corrected illnesses that occur in children. So giving a child the gift of good sight is an incredible gift. And people do not realize that frequently one of the reasons a child will fail in school is his or her inability to see the blackboard. As most education in the developing world is done on the blackboard, a child who cannot tell the difference between a 5 or a 6 may have a very high IQ, but may fail or do poorly in primary school, never go to secondary school. That same child who has their eyes corrected, their vision corrected with eyeglasses, can end up going to secondary school, university, and becoming a marked benefit to their society and to their nation. So this is an extremely important program. And we're going to break it up into 3 phases. We're going to break it up into screening, testing, and treatment. And initially, I'm only going to talk about the school program. The preschool program we're going to pick up at another video. But I'm going to make also a distinction between screening and testing. So screening is something that is done very quickly and roughly, and it is to try to determine the normals from the abnormals. Then the testing part of it will really bring out which of those children who truly need glasses, and obviously the treatment part will then refer those children to an optician for eyeglass prescription and for the providing of eyeglass to the child, and or seeing an ophthalmologist for an eye pathology problem, whether it be conjunctivitis, a eye muscle problem, a cataract, etc. So first, let's take on screening. So what we're going to do is we are going to train special community health workers that will go into the schools and screen the children with the teacher health champion. Now, when they're in the schools, I want that the screening be done by the teacher health champion with our community health worker from HopeCore, help directing and watching and observing, but allowing the teacher health champion to actually do the screening. The importance of this is to honor the teacher health champion, of which we have 2 in each of our 200 schools. So they're extremely important, and also it trains them when we're not there so that they can actually screen these children and then refer on those who need our services onto our office, etc. So the teachers will then, teacher health champions will actually screen the children. I think we should be able to screen a school in 1 or at the maximum 2 days. That's 250 children. The way we would do it would be to empty a classroom, to place a desk about 8 meters from a blackboard. We will have a standardized strip of letters and numbers and maybe even E-symbols on that chart that will be placed on the blackboard. A child we brought in sat at the chair, one eye covered, read the letters, read the numbers, same with the other eye, and then eventually with both eyes. And we should be able to screen every child in 1 minute or at least 2 minutes so that we can rapidly go through and screen a whole school. Again, that screening will be done by the teacher health champion with the HopeCore community health worker observing but not doing the actual screening. The HopeCore community health worker will be recording, though, those children who are abnormal or who are uncertain as to whether they're normal or not. We will then ask our HopeCore community health worker to take the group particularly the group that is uncertain, and test them more significantly with a Snellen chart, which is a letter chart, or a number chart, or possibly an E-chart, and make the determination whether the child needs to be sent on for a appointment in our office and the possible providing of eyeglasses. The definitely abnormals probably do not have to be tested again. They can be just sent directly to our to our office clinic, where they will be seen by an optician as well as Dr. Esther and possibly an ophthalmologist if need be. So at the end of screening a school, then, we will have a list of children who are definitely abnormal and maybe others that are uncertain but possibly abnormal. The first thing we need to do is to identify the teachers in every classroom of who the children with potential eye disabilities are and get those children to sit in the front row, to require that. Many of the children try to hide their disability and sit in the back, which can negatively affect their ability to learn. So the first thing before eyeglasses is get them in the front of the room. The second thing is to refer them on to our office, where then they will be seen by Dr. Esther and one of our nurses together. A decision will be made whether they need treatment for an eye condition like allergic conjunctivitis, or whether they should be referred to the optician for eyeglasses. Those children who have severe disease will be sent on to our own ophthalmologist, who will come once a month, and he will see and treat those children appropriately, and HopeCore then will be responsible for that eye care. Hopefully, the parents will be able to cost share, but a large part of it will be taken up by HopeCore. So that then becomes extremely important that those children that are screened are seen in the office. We work with our optician and our ophthalmologist to get glasses for these children who need them and who can get the best possible price for those glasses. Figuring that we are going to screen 50,000 children, the studies in rural Kenya show about 5% of those children will need eyeglasses. That means about 2,500 children will need glasses. Some will already have it. Some HopeCore will have to provide, and hopefully a large portion we can have some cost sharing with the parents, so that the parents can maybe pay 50% of the cost, maybe 25%, depending on their financial situation. But there's no question that HopeCore is going to have to fund a lot of this. So it's very important that the screening and testing is done as efficiently as possible, as we don't want to burn up all our money in screening and testing and then not have money to provide eyeglasses. Now, for the under fives, the preschool children, we will take that up at another time, but we are planning to use our 200 community health workers that each have 50 families each to take care of, to do the rough screening in the field, and then to refer back into the clinic. We may go out and eventually use an auto refractor in the field to screen these children, but at this point that is uncertain whether we're going to go that way or not. So initially, we're going to focus on the school children. We're going to try to get this done within 2 terms, that's 6 months, screening all 30,000 school children, and then we will begin in 2 or 3 months the program with the preschool children, and that will be picked up at another video. Again, extremely important and overlooked and often overlooked problem in global health, eye health and refraction error correction in school children. And again, our thanks to Kathy Sangster and her donors for making this whole program possible.